I understand that the following information will be gathered and utilized for educational purposes by Indiana Wesleyan students. I allow this information gathered and physical assessments to be videotaped and posted on YouTube for access by faculty. Indiana Wesleyan University, the video will be deleted by the student as soon as it has been reviewed and graded. I further acknowledge that this is for educational purposes only and the information is not meant to be diagnostic. Therefore, Indiana Wesleyan University has faculty and staff as well as the students are not considered liable.
Okay, thank you very much. Hi, my name is Kashena. I'm going to be your nurse this morning. And I'd just like to do a quick comprehensive assessment before you meet with the doctor. I understand that you have Crohn's disease. Is that your issue that
Yes.
you're following up with?
Yes.
Okay, and what symptoms have you been having?
I have diarrhea, stomach ache, stomach pain, nausea.
Okay, have you been able to hold anything down
No, I haven't been
food-wise?
able to hold any food down. I just throw it right back up.
Okay, I've read that you've been drinking boosts and supplements and things like that.
Yes.
Okay, what about vitamins?
No, not taking any vitamins.
No, you should take vitamins. Vitamins are good in replacing nutrients, especially if you have problems with absorbing food, okay? Alrighty, well, we're going to go ahead and get started. And I am going to go ahead and first, I'm going to check your blood pressure. I got to get my cuff. I'll be right back. Okay, sorry about that. Alright, if you give me your arm, I'm just going to go ahead and wrap the cuff around your arm. Okay. Lift your arm up for me just a little bit more. Thank you. I'm going to put it down here. I'm going to put my stethoscope on. Alrighty, it's going to get really tight for just a few seconds, okay? Okay, beautiful. 122/64. That's beautiful. Very good.
So that would be 120/80.
Oh, well, that's normal too. As long as it's within a certain normal range, then you'll be fine. And I'm just going to go ahead and count your heart rate. Take your pulse. Okay, 72. That is within normal range also. So we're doing good in that aspect. Alright. Next, I'm just going to take a look at your skin to look for any scars, bruising, any sores, any abnormalities, any rashes, anything like that. So let me take a look at your arms. Everything looks good there. Let me take a look at your other arm. Everything looks good there. Okay, and let me take a peek at your legs. The skin on your legs. So that's fine. You don't have to put up that high. Okay, so you have some old scarring. What's that from? Did you have chicken
Chick,
pox
chicken pox.
when you were younger? Okay. But no bruising, no open areas, no cuts, no scars, nothing like that. Wonderful. Alrighty. Let's check your skin turgor just to make sure that you're not dehydrated. Okay, skin turgor is good. Let me take a peek at your nails. Your nail beds look good. Alrighty, and you don't have any swelling or anything anywhere, which is a good thing as well. Now I'm going to just inspect your head. Can you take your hat off for me? Okay. Your head looks round, symmetrical. I don't see any abnormalities.
So what that mean if it was box shape?
If it was box shape, that would be abnormal. We would have some definite concern, but luckily yours is round, so we're good. Okay, so now I'm going to see if I can palpate your temporal pulse, which is in your temple. Okay, wonderful. I felt that. Let's see. I'm going to palpate your jaws just to make sure there's no swelling. Okay, good. Everything is even. Let's see. I'm going to palpate your sinuses. Okay, everything looks good. Feels good. Let's see. Your hair pattern, I see there's some receding patterns. Is that hereditary? And how long did this start? How long has that been going on?
Since I was 14. I don't know if that's hereditary.
Okay. And let's see. Alrighty. And your hair, it looks to be thinner in the front, but then it gets thicker in the back. Okay. Do me a favor. I'd like you to smile for me. Big smile. Show your teeth. Okay. Let me see you frown. Let me see you show your teeth. Blow out your cheeks. Blow air out your cheeks. Let it go. Blow it out. Raise your eyebrows. And tightly close your eyes for me and open them. Alrighty. And then I'm going to do the cheek function test. Okay. Okay. Alrighty. How is your sight?
Not too good.
Do you wear glasses? We have documented that you wear glasses.
Yes.
Okay. How good can you see if I cover up one eye?
It's blurry.
Okay. What about this eye?
It's a little better.
Okay. Okay, I'm just going to inspect your eyes. I want you to open them real wide. Okay, look to your right. Look to your left. Up, down. Okay, same thing with this eye. Right, left, up, down. Now, do both of them. Right, left, up, down. Okay, good job. Let's see. Now I'm just going to shine this light in your eye. Just to test your light reflex. Okay, I'm going to get a little lower than you are. Okay, look straight ahead. I'm going to shine this light in your eye. Good. I'm going to do the other eye. Good. Wonderful. Okay. Now I'm going to go ahead and inspect your ears just to see if there's any discoloration. So go ahead and turn for me. Okay. I'm going to check. I don't see any earwax or any sores or anything like that. Now go ahead and let me check that ear. Can you turn a little more towards me? Good. I see a little scar on this ear. What happened there?
I don't know.
Okay. Well, they look symmetrical and even. No discoloration or discharge. Let's see. Okay. Now I'm just going to inspect your nose. It looks to be even, symmetrical. Will you lift your chin up for me? Okay. Looks good. And then, will you, if you would, cover one nostril, breathe in and out. No, you can put your finger over your nose or your nostril. Breathe in and out. And then switch to the other side. Okay. Next, we're going to move on to your mouth. Your lips, they look a little dry, but they're pink and they're even. They're symmetrical. I don't see any lesions or scars or anything. So what you want to do now is open your mouth all the way up for me. Okay, stick your tongue out for me. Alrighty. Looks good. I don't see any pinkness or swelling or drainage. And let me take a look at your teeth again. Open your mouth wide so I can look at your teeth. Oh, I see you have one cavity. When did you get that filled? Or one filling, rather. When did you get that filled?
Last year.
Okay. And is it causing you any pain or anything like that?
No.
Okay, and let me smile again so I can take a peek at your gums. Will you open your lips up for me so I can take a peek at your gums? Now open your lips. There you go.
Like this?
Yeah, that's good. Your gums look healthy. And then let me see the top portion, please. Okay, they look healthy as well. The upper gums. Now I'm going to check for your gag reflex, which just means I'm going to put this in your mouth and put it on your tongue and hold it down for just a few seconds to see if you're able to gag and if your gag reflex is working correctly, okay? Open up for me. Okay, wonderful. That was wonderful. And then I'm just going to inspect your tongue. Will you stick your tongue out for me? Okay, all the way out. Up, back. Okay, great. Alrighty. Okay, now I'm going to inspect your neck. So your neck looks good. It looks a little swollen. Your lymph nodes are a little swollen right here. You know, that comes from your Crohn's disease. It causes your lymph nodes to enlarge for whatever reason, but they're not hard. They're smooth. And I don't feel any other nodules or anything. Your thyroid feels good. Your trachea is midline. Your thyroid is good. Alrighty, now we're going to go to your arms and your trunk. Let me have you turn your head from side to side. Turn your head from side to side. Real slow. Okay. Let me have you sit up straight, please. Shoulders all the way back. No, you can just sit like this, but arch your shoulders all the way back. Good. Does that cause you any pain or discomfort?
No.
Okay. I already inspected your arms. There were no swelling or abnormalities with that. Next we're going to check your range of motion in your elbows and wrists. So what I want you to do is put your wrists up, turn them in, turn them out. Come over a little more so the camera can see you. In, out, turn them around in circles like this. Wiggle your fingers. Okay, wiggle each finger one by one. Okay. Does that cause you any pain or discomfort?
No.
Okay. Okay. Next, I want you to grab my hands. I'm sorry, my hands. Squeeze them real hard. Squeeze them real, relax. And then push up against them. Okay, then pull them. Pull on my hands. Okay. Alrighty. The next one I'm going to do is listen to your lungs. I can untangle my equipment. And I'm going to have you deep breathe. Deep breathe for me. Out. In. Out. In. Out. In. Out. In. Out. In. Out. Okay. I'm going to get your back. Scoot up a little bit for me. There we go. In. Out. In. Out. In. Out. In. Out. Okay, that is wonderful. And then what I'm going to do is just percuss or palpate on your rib area just to check for any firmness or any irregular masses, sensations, anything like that. Okay. Okay, check your back. Okay, your spinal cord feels nice and even. Okay. Alrighty, I'm going to inspect your jugular veins. Let me see the other side. Okay, let's palpate them. Alright, nice and strong pulse. Okay. And then I am going to listen to your heart and your abdomen again. I'm sorry, not again, but I'm going to listen to your heart. Oh, I'm sorry, I have to come on the other side. Scoot over just a tad. Thank you. Sounds good. And I'm going to listen to your abdomen. Can you stand up for me just a little bit? Stand up for me. There we go, so the camera can see. You can stand that way, sir. There you go. Okay, good. You can have a seat, sir. Do you have any stretch marks on your abdomen? Any discoloration?
Yes.
Okay, and I'm just going to palpate it. Stand up just a little again for me, sir. Okay, perfect. I'm just going to palpate your abdomen. See if there are any abnormal masses or anything like that. I just noticed it's a little distended. Does that hurt when I apply pressure?
A little bit.
Okay. Your umbilical cord is your navel is midline umbilicus. So you're fine. Alrighty. Okay, so I'm gonna go ahead and look at your legs. The hair distribution is normal, which is good. Okay, let me take a look at your toes. Okay. Alrighty, your toenails look good. Okay. Then wiggle your ankles around for me and your toes. Okay. Wonderful. Alrighty. Last but not least, I want you to go ahead and stand up for me. Okay. Your balance looks good. Have a seat for me. And I need you to swing your arms around, like in a back and forth motion. Okay. And then the opposite way. Okay. Then I want you to hop on one leg for me. Last time. Either leg is fine. The other leg. Okay. All right, and one more thing. Stand up for me. Take a look at your spine again and your posture. Wonderful. Nice, strong, and erect. Okay, sir. Thank you very much.
Thank you.
And now I'm going to go ahead and get the doctor for you.
Okay.